So my title is slightly misleading because it's the hybrid closed loop real world experience. But I'm actually going to talk about our use and experience with the patch pump, which is the Omnipod 5 system. So this is a tubeless pump. It's a patch system which changed every 2 to 3 days. Works with a sensor. Most of the time we've used Dexcom, but we have used Libre as well, which changed every 14 days. So we can talk about that a little bit later. No real disclosures in here. I would like to acknowledge, though, my colleagues at the London Diabetes Centre. It's obviously a communal effort from everybody, and I thank them all very much indeed. So this is the system, the patch pump. I forgot to put a picture of that on the person. I meant to do that, so but I'll show something at the end, which I think will show you. And in 2023, in July, the MHRA allowed Insulet to prescribe the Omnipod system for us. And what happened to us was that we got a considerable demand from patients at that point. We were not expecting this at that point, but we did. And so consequently, we developed quite a rapid cohort of people on the Omnipod 5 system, on the patch pump system. And it's that data that I'm going to talk about and follow our 2-year experience with that. So this was the system that we drew up at that time, very much really, as I say, embellishing what's already been discussed. Initial contact, all of our patients were basically self-referral centres, both from within the NHS in the UK and with outside on an international perspective. We spoke to the centres. We did not do this without actually having a relationship with the patient's primary care team. We had an initial review, and as this has progressed, we've more and more got used to doing this through video technology. And I was interested that that's not been something that I've noticed discussed very much here in the meeting, and particularly in the breakthrough discussion that we had prior to this session. And I'd be interested in people's view on that. I mean, India is regarded outside of India as very high tech and mobile. You've all got mobiles. I mean, half of you are looking at them now. And so, in fact, we could be using this a lot more. We certainly have grown in confidence about doing non-face-to-face video consultations. Pump start very much along the lines which have been discussed earlier by the two speakers, and then we had a review at 3 months where our first initial data came from. Initial settings, these are sort of the things talked about already, first follow-up and lots of education to go with it. So these are the baseline characteristics. We had both adult patients and pediatric patients, as I say, self-referred or on the international basis, and they came from all over the place at that time, and this has continued very much over the last year. Our patients were what you'd expect, very wide age range, very wide duration. Pre-pump HbA1c was variable from good to bad, and some were a little bit overweight, some were not, and lots of it. So a real mixed bag of people who came to us for demanding the system. And this is what happened in the first 3 months of use. So we got a rapid change straight away, and that persisted over the first 3 months, very much on the lines that have already been discussed. The changing, the variability was also there, and the improvements in the target glucose and improvements in the concern over hypoglycemia. So very much mimicking what's been there. So this patch pump with its algorithm placed in the system did all the things that have been discussed previously in the Minimed system. Time in range, as I say, was improved. There's no difference in adult or pediatric, so there was not a change in there, and there was no difference in people who had already been on pumps versus those who were new to pumps, and it was about 50% were pump users, 50% were not pump users. I think this is one thing which I think is important, that that's not perhaps come out in the discussions already is that the control that people were on previously, even though they were demanding the new pump, mattered. In other words, if you had good control at the beginning, you got a much better TIR with this pump over the first 3 months. And similarly in the HbA1c. So behavior does matter with an automated pump delivery, as Professor Wyszkowski demonstrated. So you've got to be aware of that. The first year, no change. It improved, the improvement continued. The adults and the pediatrics were the same, and we remained with a good TIR, very similar throughout the whole period. And that's persisted for 2 years, and that's really echoing what has already been said, that once you start these people on this system, once they get used to it, once they start using it properly, and that really happens in the first 2 to 3 months, they persist, and it's a tremendous treatment. One thing I would just like to say about this in relation to Ben's talk at the beginning is that you printed your first slide about the guidelines. This is the model treatment. As somebody who's been around diabetes for quite a long time, this is phenomenal, absolutely phenomenal. It's changed direction, and it's changed very quickly over the last 5 to 6 years. It's phenomenal aspect. So automated insulin delivery is a success, and it persists. So what did we learn from all of this on our patients? So first of all, people with diabetes are motivated. They want the best for themselves. And I think as physicians, we've got to be aware of that. It's important that we actually work with our patients to this. It's a worldwide clientele. They all know about these things because they go on the internet. You've got pump users, and new to pump patients are eager to look for different technology, and it's right across the age spectrum. You get significant improvement straight away, and that's to be looked at, and both in terms of the glucose and its variability, and the risk of hypoglycemia disappears, and that's really important. The second thing is we've had sustained improvement. We are looking at a TIR in 70%, which, as I say, as somebody who's been around for diabetes a long time, that was something that you never even thought about. But you get it at 12 and you get it at 24 months. Children and adolescents respond equally, and so do people who've been on pumps but are also new to pumps. And I think that this is important, that those people who are good at looking after their diabetes get the maximum from pump system, and adherence to the pump system management is really quite important, just as the same as it is with adherence to insulin injections. And counting carbohydrate, insulin adjustment, regularity is what I would say more is important in terms of life, even though the algorithms are really quite good at picking up on the whole variability. And the routine of diabetes, I think, is still important in this system. An outpatient-based pump start program is feasible, and particularly with use now with more modern communication technology. And I'd be interested to know how people in India feel about that. And finally, as a referral centre, it's very important to actually have a partnership arrangement with the primary care team, which are going to support the people back in their own individual localities. And thirdly, you get the same sort of results with the tubeless automated insulin delivery system. The capacity in the NHS in the UK is increasing all the time, and most people nowadays are looking more and more at a patch pump system. And the opportunities are there to develop a more flexible implementation models with telemedicine. And these are the same things that have been already discussed today. And I particularly, as a pediatrician, was interested in parents and children's reaction to this. And this idea of I seem to have control of my diabetes for the first time. It's become routine at schools. Schools are accepting this without any issues at all in the UK. Big thing from parents. My wife and I are sleeping through the night for the first time ever. That was a massive, massive plus factor. And they're beginning to relax with the machine taking over. Are there any downsides? Well, we had one downside from a family, and this was a family from Malta, actually, and their boy had been given by the Maltese Diabetes Association, which is a very active, the small island, Malta in the Mediterranean, and they gave this family a diabetes dog. And I don't know whether you have these in India. You do? No? Don't. So these are dogs which have been trained to actually help people with diabetes, and actually particularly in terms of hypoglycemia. So the family had been given one of these by the local association, right? We put this family on an Omnipod 5 pump system, and sadly they took away the dog. And the boy was bereft. This was his friend, but he had to give it back to the association. So that was a bit of a disappointment, actually. But in a sense, joking aside, that's the only major problem that we've had with the system. Parents have taken these on board, children have taken these on board, and so on. We were a little bit naughty in that we put this little boy, or I should say this big boy actually, who's strictly under the age of 2, but he was a big lad, as we would say in the UK, and that's his Omnipod system there, and he took to it extremely well without any trouble. So he wears the Omnipod system there, and he has a Dexcom system at the front in the abdomen. Finally, I'd just like to sort of mention about what this is my favorite graph of all time, which is so-called the Gartner hype cycle. And this applies to any development, whether it's technological, social, or whatever you can get. So in other words, you've got the so-called visibility on one axis and the developmental time. And something happens, you have a technology trigger, it's wonderful, and it goes up to what's called the peak of inflated expectation. It's the best thing ever. But then all the complications come in, and you go through a trough of disillusionment, and you then eventually find out where your level is at. And insulin, diabetes technology has gone through that over the years. But I think in the sense, funnily enough, I think the delivery of using the artificial intelligence systems, the algorithm systems, and so on, is probably actually one of the areas where the Gartner graph is not quite so explicit, because I think there's constant development all the time from the companies, which they have to be congratulated for in terms of insulin dose, the algorithms has been discussed today, the pod developments, the sensor developments, and the whole apparatus around this. And they will continue to develop over the next few years. So what we're talking about now in the next X number of years is not going to be the same, and they're going to be different. And my example about that is the fact of the launch, I think it's in San Francisco, but I'm not absolutely sure, of driverless taxis. I can't believe it that actually anybody gets in them, but they do. So that's something to aspire to. So I thank you very much indeed, and as I say, a slightly different pump system, but one for discussion. Thank you.